the weird part of the population where I feel like it's hereditary. I'm a third generation nurse, so my dad says it was in my blood to become a nurse from the jump. Um, I think, but more often than not, is seeing, my mother or my grandmother, my aunt, growing up as a nurse, seeing what they did. I loved how they helped people, but they helped people in such different ways. My mother was a correctional nurse, my aunt was a neuro ICU nurse, and just seeing, different populations, they cared for them just the same. And I like that aspect of it, is that regardless of population, where you come from, different backgrounds, that we can all care for people just the same way.
I was a paramedic for almost 10 years before I did the jump to become an RN. Being a paramedic, you can do a lot of things as a paramedic. However, with nursing, there's just so many things you could do. Informatics, management, education, all kinds of things. So it's just a vast sea of opportunity for you as a nurse. So I just wanted to use that as a bridge to continue to do more.
So I knew that I liked science whenever I was younger, and I also really liked to help people. So my mom, whenever I was in high school and we're doing all the tests to figure out, okay, what do you want to be when you grow up? She suggested that I be a nurse, and I kind of went with that. And I did get some experience firsthand. I started working at MD Anderson to do patient transportation, and with that it kind of told me whether I would actually like the hands-on patient care, and I really did. It seemed like every time I would go into the hospital, no matter what was going on in my life, really working with patients kind of humbles you in a way, and I don't know, it just makes your heart feel a little bit more filled whenever you have the opportunity to care for somebody that's not in as good as a position as maybe you are that day.
For me, I actually started off as a music major, and I did that for 2 years, and then I started thinking about what could I really do with this in school, in life. So then I started hearing a lot about nursing, and the school I was at had a really big nursing program. I went to Stephen F. Austin in Nacogdoches. And so I started the application process. I met a lot of people that were in the program, and then I just started doing research and learned so much about how there's different opportunities, different directions you can go with nursing. It's not just one thing you can do as a nurse. So when I left SFA, I came back to Houston, and I actually went and got my CNA license, just so I could see it's working in healthcare really for me, and I actually really enjoyed it. So then I started taking all my prereqs, and I got my ADN, and so I've been working as a nurse since then, and I've enjoyed it.